Currently, I have a couple married for almost 4 years now. And they have never been able to consummate their marriage. And a number of couples will come and you say, this one, after he has just gone one round, he can't start again and everything. It's foolhardy to try and get a tired horse to try and win the next race.
Herbal supplements, mukombero and those things, do they work?
Dr. James Ikol. He is a member of Kenya Association of Urological Surgeons.
He has been helping individuals and couples overcome sex problems for over 20 years.
I mean, sex toys have been there since time immemorial. If you read about the history of the pharaohs and everything, you'll find sex toys have been there, sex dances. All of these are supposed to help in improving the arousal.
Young men are abusing these pills and substances. I'd like to understand, what is the effect of these pills if continuously abused?
In persons with low testosterone, people with nerve conditions, for example, which is common in diabetes, among others, you see, if you do not sort out the cause, these drugs are not going to increase sensitivity, right? They're not going to increase nerve sensitivity. You see, for a man to be raped, the man has to get an erection, right? That's the only way he can be raped in terms of heterosexually. So to get an erection, one has to be aroused, as opposed to the other way around. Okay? So for the man, at the end of the day, this sexual arousal culminating in the rape may actually lead to it may lead to an orgasm. So in each case, a raped man is not necessarily going to report because it may sound like it was a pleasurable act for them. But you see, for women, it is different, because a woman who is being raped doesn't have to be sexually aroused, right? And you see, the sexual arousal system in women has to deal with a lot of lubrication of the vagina, which doesn't happen when
they're being raped.
When they're being raped. So in which case, therefore, that the woman is going to get hurt as opposed to the man, right? So, of course, the woman getting hurt, then she's likely going to report it. So there's that aspect which I think affects the numbers. So it's not very clear to say that, yeah, it is men who are perpetrators or what. It's just, at the end of the day, who is likely to report? A woman is more likely to report a rape than men.
No, man.
Yeah.
You mentioned an orgasm in the previous statement, and that leads me to a statistic where about 75 to 80% of women never achieve an orgasm or a climax. Why?
Yeah, that's a very interesting question. I think we throw back and look at the sexual cycle. And if we look at what has been researched and documented as the sexual cycle, has like 4 phases which generally overlap. The first phase being desire. Then another one being arousal, before finally you get to orgasm. So the level of desire and arousal determines when and if one is going to have an orgasm. And for different individuals, the durations of desire and arousal vary. And generally you find it is probably, arousal is probably faster in men, right? Very easily get aroused by what you see, what you smell, what you think. When you look at women, the arousal part maybe has to be a little bit more intense. There is a lot of what she will be feeling at that time. So such that if one does not arouse adequately, then it is unlikely that one is going to have an orgasm. And then generally you'll find that in the anatomy of men and women, the sexual excitatory tissues in females, where we look at the clitoris and we look at the G-spot, are kind of hidden as opposed to in men, because in men the most sensitive part is the glands, the head of the penis.
Yeah.
So stimulation of these areas is what is finally going to lead to an orgasm. So you'll find that for most women, they require a higher level of stimulation as opposed to men. So when you look at a couple, therefore, a couple has to know themselves and understand how long will it take for me to arouse and stimulate my partner, and find a way of managing that so that at the end of the day, everybody is going to be satisfied. So generally, men should not be in a hurry, therefore. Okay? Yes.
Does achieving this orgasm mean that someone has a good sexual prowess? Does it necessarily have to end with an orgasm all the time?
It doesn't have to end with an orgasm all the time. And indeed, I must say there are different intensities of orgasm for the same couple. The level of satisfaction of a sexual act varies from time to time. At one time, I usually tell the men who come for my consultation that an ejaculation and an orgasm are two different things, right? An ejaculation is just the emission of ejaculate. You can ejaculate without being satisfied emotionally of the sexual act. Okay? So there are therefore different intensities of orgasm. So for that purpose, therefore, you'll find it is different all the time. The feeling is different over time, because an orgasm is a level of sexual satisfaction. Sometimes you don't achieve that level. Sometimes you achieve a lower intensity. Sometimes one has a very high intensity of orgasm, and it varies among individuals within the same couple and from time to time. Yeah.
Does sexual compatibility come in this context?
Yes, I believe sexual compatibility does come in, because if you look at the first two phases of the sexual cycle, where there is desire and there is arousal, if you're incompatible, you don't desire each other, right? So for as long as you don't desire each other, then you kind of don't get to arouse each other. So in more compatible individuals, then you are able to desire one another, you are able to arouse one another, you are able to understand each other's level of stimulation, you know what to do when, you know what to stop doing what, so that you delay your partner here and there. Then you understand how to wait for your partner also, so that at the end of the day, you may synchronize your orgasm. It's not always the case, but somehow you'll find that even if there's a diversion in terms of when the orgasm occurs between the two sexual partners, you'll find that the duration is not so varied, right? If the couple understands each other and are able to take care of each other's needs. So that is where compatibility would come in. And then, of course, when you look at the final phase of the sexual cycle, what we call the resolution phase, it is good to understand, because you'll find even in the consultation, a number of couples will come and you say, this one, after he has just gone one round, he can't start again and everything. I mean, of course, you look at the biology and look at the sexual cycle, you'll find that it has been documented that the resolution phase in a man is around 30 minutes. The resolution phase in females is shorter. So I usually tell my male clients, I mean, after you have had an orgasm, it's probably pointless trying to start again in the next 5 minutes.
Are there techniques to to shorten that time?
Not really. I mean, it's kind of a natural thing. Just give the body time to recover, to reset. Then you can start again. Yeah. It's foolhardy to try and get a tired horse to try and win the next race. So you have to give the horse time to recover, gain energy, and so that they can start again. Yes.
These herbal supplements, mukombero and those things, do they work?
Yes. It's interesting. I mean, when you look at research, there's a lot not proven. And not much research has gone into a lot of these herbal preparations, but folklore has it that they work. Where there's smoke, there's fire. People have used it. Whether it is psychological, is a question mark, or whether it is an actual chemical process. But if you look at those that have been studied, it is thought that some of these herbal components have a way of either increasing the level of testosterone, increasing the blood supply to the genital area, or indeed increasing sensitivity to testosterone. And this becomes very important in the older male, because in the older male, we have reductions in testosterone sensitivity. You may not have the testosterone reducing, but the sensitivity reduces. So anything that can enhance sensitivity to testosterone then gives this person a better chance at sexual satisfaction. So the answer to the herbal question is yes and no. All right? Some have been thought to work, some have not been thought to work. The dose also in something that is not researched. You cannot calculate the dose.
Yeah.
I'd say, okay,
this one works at this amount.
Takes 3 sticks, takes 5 sticks. Somebody will come and say, yeah, I just chewed half a stick and I was okay.
Yeah.
Another one will come and tell you, well, I've chewed 10 sticks and I don't feel anything.
Yeah.
Right? Yeah, so that is something, yes and no. And then we also have to remember that, like we alluded to in the first question, the psychology of sex. There's a lot of mental issues that go into sex. So maybe the medicine is just a feel-good factor.
Right? The placebo effect as well.
Placebo effect. And you are like, oh yeah, this thing is working. But yet it is just a placebo effect because it has reset your mind. Yeah.
Nice, interesting.
Yeah.
And when we come into the synthetic side of it, the pharmaceuticals, we see that there is a pandemic right now where young men are abusing these pills and substances. I'd like to understand, what is the effect of these pills if continuously abused? And secondly, do these pills work for women as well?
Yeah, I mean, the prescription medicines, the PDE5 inhibitors, have been used a lot. It was a real breakthrough in terms of science, finding the effectiveness of PDE5 inhibitors, which initially were made for treating hypertension and heart disease. The way they work is that they improve the blood supply in the genital area. And sexual arousal is associated with a lot of improved blood supply in the genital area. Okay, so these medicines therefore improve this blood supply both in women and in men, and that is generally how they work, right? So with that, therefore, one is able, for a man, for example, is able to get a firmer, harder, and a little bit more long-lasting erection, as opposed to when it is not used. So yes, they work. The problem we are having now is abuse. Abuse in that we are having a lot of people who do not need to take them, taking them. Okay? In conventional medicine, we treat a diagnosis, right? When you look at erectile dysfunction, for example, we want to identify the cause. what is leading to this erectile dysfunction. Because if we do not address the cause, no matter how many tons of PD5 inhibitors one is going to take, the cause has to be addressed. So if you look at in persons with low testosterone level, for example, it doesn't matter how many pills you're going to give them. They won't get the erection because you need testosterone to allow for the desire and stimulation to come up. If we look at people with nerve conditions, for example, which is common in diabetes, among others, you see, if you do not sort out the cause, these drugs are not going to increase sensitivity, right? They're not going to increase nerve sensitivity. So it doesn't matter how many you take. If you look at diseases like circulatory disorders like hypertension, atherosclerosis, which is little plaques in the blood vessels which affect circulation, those medicines are not going to change that. So we therefore advise that before one starts taking these pills, it is good to have a consultation with your physician so that the physician can correct some of these abnormalities. A correction of some of these abnormalities will lead to one getting back their erectile function. And then from there, then maybe one can put in this PD5 inhibitors. Young people are taking them. Do we think they need to be taking them? No. But why are young people taking them? You'll find a number of young people are consuming other things. You'll find one is smoking, right? That definitely will affect their erectile function. Chewing cut, excessive alcohol consumption, all these will dampen their sexual function. So you'll find a young person doing all these things and then wants to correct the sexual function with the medicine. You have not corrected the cause. So we say, why don't you stop smoking first? Why don't you stop taking alcohol? Why don't you stop chewing cut? And then let's see how the erection behaves. Yeah. Don't assault your body and then use another chemical to try and sort out one aspect. So these are a number of things we are seeing. And then we are also seeing people who have English sometimes disappears. They kind of have their idea on performance and the sexual act is out of what is natural. Because you'll find...
Do you think pornography comes in there?
And pornography comes in there. So at the end of the day, you have a lot of unmet expectations because you had abnormal expectations, right? And some of the abnormal expectations is where somebody wants to, you find a man saying, my sexual act is 1 hour. 1 hour is too long, right? The sexual act is almost 5 to 15 minutes. And you find somebody saying, okay, now, mine, it was just 5 minutes and it's finished and everything. That is natural. Now, if you want to push it from 5 minutes to 1 hour or 1.5, you have abnormal expectations. Okay? And because of that now, those are some of the reasons why we are having abuse of some of these medications, yes.
What is the end goal? What happens when everyone, say me, I consume every single time I'm going to have sex? And what happens to me long term?
Of course, it's going to reach a point where you cannot perform without them, right? And then it's going to reach to a point when you want to use a higher and higher and higher dose. And there is a dose beyond which then the medicines become toxic to you. Then they're going to cause adverse reactions. So we must never forget that all medicines are poisons. Okay? So it's just that a safe dose has been calculated. Safe beneficial dose has been calculated. Beyond that level, then you'll be hurting your body. So that is the drawback. So you'll find now individuals requiring more and more. get to a dose now which causes problems. Then they get frustrated. Yeah.
Are sex toys necessary during such acts?
Sex toys is an interesting question, and I mean, sex toys have been there since time immemorial. If you read about the history of the pharaohs and everything, you'll find sex toys have been there. Sex dances, all of these are supposed to help in improving the arousal. Okay. From a medical perspective, we find that our levels, if you take erectile dysfunction, for example, in medicine, for example, we prescribe things like penile rings. We call them cock rings for people who have blood supply problems on the penis, where the erection lasts very short because of leakage in the veins and something like that. So in such people, we prescribe what we call cock rings, so that just to keep the penis engoined for a little bit longer. And cock rings are also used in people who maybe have had surgery, have blood supply issues, used in conjunction with the vacuum devices. So yes, sex toys do help from a medical perspective. We could go back to females and then we look at it and say how much of arousal is required. So you may find in partners the level of arousal required by the female partner is much higher than what the penis itself and all the other things people do can offer. That is the basis, for example, of the ribbed condom. The ribbed condom is one of the oldest sex toys, right? All of that is supposed to increase the arousal. Then we have dildos. And dildos are designed in a way that during the sex act, they can have contact with the clitoris and a little bit deeper on the G-spot. So all these are supposed to be used to enhance the arousal and therefore one to achieve sexual satisfaction. So yes, they help, especially in people who have to have higher levels of arousal. Must they be used all the time? It depends on the couple. Okay, because at the end of the day, what you aim to do is to have sexual stimulation.
There's a concept called jelking, where the vacuum devices I used to try and stimulate growth, apparently. Does that work?
It is good to understand that we generally cannot enlarge the size of the penis. So many things have been done to try and enlarge the size of the penis. When you look at jelking, for example, it is a vacuum device with a cock ring, right? So what does the vacuum device do? Get the penis engorged with blood and then have a cock ring to prevent the blood running out. So this is a temporary measure, okay? We do understand scientifically that the male erection is a blood supply issue. You increase the amount of blood getting into the penis, right? That is what is going to cause an erection. So vacuum devices have been shown to assist in improving blood supply, and then the cock ring, which comes with it, prevents the blood or slows down the blood from getting out. So it is temporary, all right? It may serve for that moment, but I must say that even with the use of vacuum devices, one is not able to get a hard enough erection as one would get in a natural one. Yeah.
With the vacuum devices, are there chances of it causing micro tears on?
Yes, certainly yes. Even on the skin, because they may cause abrasions, skin abrasions. They may cause micro tears on the skin, the blood vessels. Yeah, all that can happen. And if you use excess pressure, more than prescribed, most of them have come with a pressure control system so that you can't go beyond a certain level. Yeah. So you can't get tear of tissues if the pressure is excessive, yes.
And as we age, this is a question I got from the audience on social media.
Yeah.
Does the penis shrink as we age?
Yeah, I mean, look at the anatomy of the penis. It is said that maximum penile growth will have occurred by the age of 19. Beyond that, you can't make it bigger, you can't make it smaller. But remember, even below the skin of the penis, there is fat, right? There is an amount of fat around all the structures of our body. Now, what happens is as we age, our fat levels generally decrease, right? And that is why you see we start wrinkling on the face and different sides of the body. So that would lead to an element of shrinking, or an element of the penis looking like it has grown smaller. And indeed, our bodies are made in such a way that our cells, as we age, keep reducing in size. They keep reducing in number. So there would be a slight reduction in the size of the penis. Then you look at testosterone also. As men age, the level of testosterone and sensitivity of testosterone goes down, right? So testosterone is what makes us muscular, right? As we keep reducing our muscle, then as we keep reducing testosterone and testosterone sensitivity, then we start losing our muscle bulk. And this is globally throughout the body. Yeah.
Interesting.
Yeah.
Is there a link between excessive masturbation and prostate cancer?
No. A lot of research has been done trying to establish any relationship between sex, orgasm, and prostate cancer. So far, there's nothing linking the two. Prostate cancer is completely an individual thing, running in families and sometimes coming sporadically. But sexual behavior and characteristics have not been associated directly with prostate cancer. Yes.
For men who have low testosterone, or generally athletes, what role does testosterone replacement therapy play?
Yeah, that's an interesting question. We have to look at testosterone replacement very carefully. We know that exogenous testosterone, right, will kill sperm production, right? So you have to have a delicate balance. When you are doing testosterone replacement, the first question you ask yourself, does this man want to have children? Okay? Because the minute you introduce exogenous testosterone, then that will affect spermatogenesis. Okay? Now, when we look at athletes who use anabolic steroids, they want to build their strength,
Yes.
right? Through building their muscle power, muscle bulk, and everything. So they want to increase that. Of course, the use of external anabolic steroids, if you take testosterone by injection, by patch, or by gel, this will reduce or kill the ability to make sperm. Okay? I'm not sure whether many of them know that or many of them are advised. So we generally do like to advise persons, like when I say somebody who needs testosterone replacement, and indeed there are those people who cannot do without a testosterone replacement, you must understand the side effects, such that use the testosterone itself in somebody who doesn't desire, who has no need to have children of their own at some point. Otherwise, then we have to use HCG, right? Where HCG now is HCG injection is going to promote the inherent testosterone synthesis so that it is done by the body itself. Okay? And that way, then one is going to be able to preserve spermatogenesis as well.
Interesting. And since majority of our audience are mostly young men and women, and we've discussed quite a broad number of questions, topics that usually affects the society. What would you advise these young men and women?
Specifically on men's health?
Men's sexual health.
Yeah, I mean, sex is a very important and integral part in our lives. So we need to be aware of ourselves. We need to be aware of our bodies and the changes that occur with age, and get ourselves to accept that we are who we are when we are. Okay? So that if you are able to get an erection every day at the age of 19 during your sexual peak, don't be too shocked when at the age of 40 it's going to be less frequent. Right? That is who we are. That is how we have been made. So we need to understand ourselves and accept our biology. Okay? Look after ourselves and subsequently use our biology and ourselves in a beneficial manner rather than a manner that is going to destroy our bodies one way or the other.
Nice. There's one final question I forgot to ask, and this is something that came on through social media.
Yes.
Is there such a thing as sexual addiction?
Okay. Yes and no. We have all come across people who, one or two people who have a little more frequent sex than others. As to whether that can be defined as an addiction is a question mark. I know, for example, one or two friends of mine who may have sex with more than 2 partners daily, right? Of course, from where many of us sit, that's abnormal.
Yeah.
Okay. Are we going to define that as an addiction? Question mark. Okay. Yes.
Do you get patients who come in with weird sexual fantasies and practices?
Yes, certainly. There are so many. There are so many people with different thoughts than what we would think, or than what I think, for example. I mean, there are those who one can't even get aroused. I mean, currently I have a couple married for almost 4 years now, and they have never been able to consummate their marriage.
4 years.
4 years. They have never been able, and they are very committed to each other. They come as a couple to the office, and going through everything, we have never established where the problem is, right? Then, of course, there are those who come and they are like, yeah, I want to do it this frequently. She doesn't want, or he doesn't want, and all that kind of stuff. And then there are those who, especially in people who watch pornography, for example, where they watch very weird things and they want to replicate that, okay,
Yeah.
in their relationship, right? So all these people come, and you'll find that this is what I talked about earlier, abnormal expectations, right? Or non-conforming, let's call it non-conforming expectations. They are there, and generally we just try and cancel them and say, know yourself, know your body, and this is how it was made. Yes.
Nice.
Yeah.
I think we've come to the end of it.
Yeah.
We genuinely appreciate you guys for being there, staying there. We'll keep on bringing in guests who share knowledge. A huge depth is essential when it comes to medicine and health. We are genuinely thankful, and keep supporting us, keep sharing this, keep engaging with us. Try getting more numbers such that we can scale our production, scale the service or whatever we are doing. So stay tuned. Laughing Labcoat. Peace out. How is
Thank
it?
you. Oh, it was nice. Lovely. Yes.